In 2010, I read the book Anatomy of an Epidemic by Bob Whitaker. My husband did, my colleagues did, several people around the world did.
And I can remember just wanting to scream as I was reading it.
And I realized, oh my gosh, this book is telling the story of what I've lived through. Because when I was reading the history of mental health and the services, I was reliving my work experience.
I felt that it was well enough researched that I couldn't just put it down and walk away from it. I had become pretty critical of the profession, particularly the influence of the pharmaceutical industry on the practice of psychiatry, medicine in general.
We have this epidemic, and we have more people and more people and more people who are living on Social Security, SSI, disability, considered stable, and they're really not well.
Not only might these drugs not be as effective as people think, but when people are on them long term, the outcomes may not be as good as we had thought.
How it majorly impacted my own life was when my son became psychotic. I remember seeing him, and he was, at that time, probably given a neuroleptic or something. Anyway, he looked like he was in a fog. We wanted to take him out, and they said, if you take him out of the hospital, we can't help you anymore. If you take him off the drugs, we can't help you anymore.
We've got to do something about this. We're going in the wrong direction, making people disabled, permanently disabled. That's not wellness. That's not recovery.
So when I was reading Bob's book, I was just so full of feeling. And so I called him again and said, what can I do to help?
We were so taken with the book, we got in touch with Bob Whitaker, as did several other people, and he put us together, and we had our first conversation in February 2011. The foundation was formed to take a look at research and match the passion of private philanthropy with the world's top researchers and programs to bring recovery-based care to every community. It's a tall order. It's going to take all of us, and we're grateful that Bob Whitaker got us started.